Did you know that 95% of serotonin is made and stored in our gut? In this video, we will be unlocking the fascinating secrets of the gut-brain connection, the biological circuit in our bodies which influences our behaviour, our appetite and our mood. We will be talking about what the gut-brain connection is, why it affects our mood, taking a look at the research on gut health and psychological health, and also discussing some practical tips on how you can optimise your gut health. So let's dive in. Firstly, let's talk basics. The gut-brain connection refers to the physical and chemical connections between your gut and your brain. These connections are communicated largely through your vagus nerve, a long nerve which extends from your brain right down to your large intestine and is part of your parasympathetic nervous system. Your stomach and intestines are teeming with trillions of bacterial residents, and this vibrant community is known as the gut microbiome, and it influences more than just our appetite and digestion. Imagine your vagus nerve as an information superhighway connecting your gut and your brain, and they are in constant two-way communication about our mood, our appetite, and many other essential functions. As a result, our gut microbiome is often referred to as our second brain, and the key players in this gut-brain connection are the trillions of microscopic bacteria living in your gut. As well as producing essential nutrients from the food we eat, our gut microbiome is also responsible for the production of neurotransmitters such as serotonin, gamma-aminobutyric acid, GABA, and dopamine, three chemical signalers that are strongly associated with regulating our mood and stress levels. Besides hormones and neurotransmitters, your gut microbes also produce other chemicals that can affect your brain health. One group of chemicals is short-chain fatty acids and are produced when your gut microbes ferment dietary fibre. These have important effects for reducing inflammation in the body and regulating our immune system. Maintaining a healthy and diverse gut microbiome, therefore, has important implications for your gut health and your psychological health. So let's take a look at some of the research into gut health and mood. A study by the California Institute of Behavioral Neurosciences and Psychology concluded that there may be a significant connection between the type of foods we eat and symptoms of depression in people of all ages. Now, while the factors that cause depression are of course wide and varied, they found that following a healthy diet, particularly one that incorporates vegetables and fruits, and avoiding ultra-processed foods such as junk food, may actually lower your risk of developing depressive symptoms. Now, the precise mechanism of the connection between diet and mood is not yet clear, and clearly more research needs to be undertaken, but eating a healthy diet does appear to have significant benefits for our mood. So what role then might the gut microbiome play specifically in this? Well, there are several studies exploring the links between our gut microbiome and our mood, and the research is expanding all the time. For example, the School of Psychiatry at Oxford University reported a 50% reduction in symptoms of depression in previously depressed patients just 1 month after taking a probiotic supplement. What made this trial interesting is that there were no other mental health interventions, and the supplement included the lactobacillus and bifidobacterium strains of gut bacteria, which are closely correlated with mood improvement. Other research studies have shown that our gut microbiota has a significant impact on our immune system, brain development and behaviour, and alterations in the composition of our gut microbiome led to the onset and progression of several mood disorders, including depression. These potentially mood-altering good gut bugs are known as psychobiotics, but it is still too early to determine the exact mechanism of why these changes in mood occur, so more research is needed to help us understand this better. Furthermore, traditional antidepressant medication and talking therapies such as cognitive behavioural therapy is still shown to be effective in treating moderate and severe depression and anxiety, and it cannot be scientifically recommended that probiotics replace antidepressant medication at this time. Now let's consider some of the ways we can keep our bustling gut microbiome in the best possible condition. What goes on your plate directly impacts your gut bacteria, and there are a variety of foods that can help the bacteria in your gut maintain a healthy and diverse balance. We now know that foods that are rich in omega-3, such as oily fish including salmon and mackerel, can help increase the amount of good bacteria in the gut. Probiotics, foods containing higher levels of live gut bacteria such as natural or Greek yogurt, kimchi and kefir, can also help maintain a healthy gut microbiome. Prebiotic foods, foods that contain fibres that our gut bacteria love to feed on, such as grains, nuts, seeds, fruit and vegetables, also help fuel the growth of the microbiome and support a healthy gut-brain connection. A healthy, diverse diet ensures a thriving gut bacteria community. Consider incorporating a range of fruit and vegetables, fermented foods, and foods rich in omega-3 into your diet. Probiotic supplements containing lactobacillus and bifidobacterium strains may also be beneficial to help maintain a thriving gut microbiome. Please remember, however, this is general healthcare information only and is not tailored to individual needs. And if you are immunocompromised, pregnant, or have a serious existing medical condition, please consult your doctor or nutritionist before taking any live bacteria probiotic supplements. And it's not just about food. Other lifestyle factors play a pivotal role in the well-being of your gut microbiome. Did you know factors like sleep, exercise, and even stress significantly impact your gut health? Stress. When life throws curveballs, our bodies pump out cortisol, the stress hormone. While short-term bursts are entirely normal and can prevent inflammation, extended periods of intense stress elevates cortisol levels. Excessive cortisol can suppress the growth of beneficial bacteria, leading to a decrease in overall diversity. This can weaken the gut's ability to break down food, fight off disease, and produce crucial vitamins. Sleep. Sleep deprivation isn't just bad for your mood, it can cause an increase in stress hormones like cortisol, which disrupt the delicate balance of your gut bacteria, impacting your immunity and how we convert food into energy. Aiming for an average of 7 to 9 hours of quality sleep can really help nurture your gut microbes and leave you feeling refreshed in more ways than one. Exercise. Exercise isn't just good for your heart and muscles, it's great for your gut bacteria too. Physical activity promotes the growth of beneficial bacteria, aiding digestion and reducing inflammation. Whether it's a brisk walk or high-intensity workout, getting your body moving can nourish your inner ecosystem and boost your overall well-being. There is a link in the description below to the NHS website which contains guidance on moderate and vigorous exercise levels, and please ensure your activity and its intensity are appropriate for your fitness levels. So to summarise, manage stress. Practice relaxation techniques like yoga, purposeful deep breathing and meditation, which can help keep cortisol levels in check and your gut microbiome healthy. Prioritise sleep. Aim for consistent sleep routines and 7 to 9 hours of quality sleep if you can. You can learn more about good sleep hygiene practices via the NHS website, and I've also put a link in the description below. Move more. Regular exercise, even moderate activity, can significantly benefit your gut bacteria. Remember to speak to your GP or healthcare professional first if you have not exercised for some time or if you have medical conditions or concerns. By prioritising sleep, exercise and stress management, you can pave the way for improved digestion, immunity and overall well-being. So our gut microbiome plays a key role in the production of the feel-good neurotransmitters serotonin and dopamine, and it uses the information superhighway that is the vagus nerve to stay in constant two-way communication with our brain. The research on gut health and mental health is still in its infancy, but it is starting to show us what we eat affects the health of our gut and how the health of our gut affects our mood. There is still a long way to go to understanding this connection, however, and traditional antidepressant medication and talking therapies such as cognitive behavioural therapy remain effective for depression and anxiety symptoms. The good news is that there are things we can do to help improve our gut health, such as eating more plants in our diet, taking regular exercise, and remembering to relax and recharge. You may wish to explore taking a probiotic supplement alongside these changes, but remember to consult your doctor first if you are immunocompromised, pregnant, or have serious existing medical conditions. I hope you enjoyed this video. Please let us know your thoughts in the comments below, and I look forward to seeing you again in the next video.